This video was intended to train healthcare workers and provide them with practical information of the safe and accurate use of SD Bioline Syphilis Rapid Test. Syphilis is a curable infection caused by a bacterium called Treponema pallidum. This infection is sexually transmitted and can also be passed on from a mother to her fetus during pregnancy. Most persons with syphilis tend to be unaware of their infection, and they can transmit the infection of their sexual contacts, or, in the case of a pregnant woman, to her unborn child. If left untreated, syphilis can cause serious consequences such as stillbirth, prematurity, and neonatal deaths. Since most patients with syphilis have no symptoms or signs, diagnosis relies on a blood test for the detection of antibodies. There are two types of serological tests: non-treponemal test and treponemal test. Non-treponemal tests, such as VDRL or the RPR, detect antibodies to a lipoidal antigen, resulting from the interaction of the host with T. pallidum or from T. pallidum itself. In the treponemal tests, the most frequently used tests are the TPHA, TPPA, or the FTA-ABS. When positive, these tests are considered evidence of a previous or current infection with T. pallidum. These are laboratory-based tests that require equipment and trained staff to perform. For the remote areas where there are no electricity and trained personnel, a rapid test can be used in all healthcare settings to allow immediate treatment. Testing algorithms and treatment decision are suggested by WHO. If RPR is not available, test with rapid test and treat all patients with a positive result. However, where RPR is available and performed well, rapid tests may have a role in screening test. SD Syphilis Rapid Test is a one-step, simple, rapid, accurate test. SD Bioline Syphilis Rapid Test is designed for detection of antibodies of all isotypes, IgG, IgM, IgA, against Treponema pallidum. Serum, plasma, and whole blood can be used as specimen, and test result is only 20 minutes. Also, it doesn't require any electricity or equipment. Storage condition is at room temperature for 2 years. Sensitivity is 99.3% and specificity is 99.5%. This CE-marked SD Bioline Syphilis test was evaluated by WHO with outstanding performance results. SD Bioline Syphilis Rapid Test is easy to use. The materials included in the kit are test pouch, buffer, and package insert. For whole blood test, alcohol swabs, lancets, and capillary pipettes are provided if required. These materials should be prepared before starting the test. New unopened test pouch. For whole blood test, new disposable capillary pipette. For whole blood test, new unopened alcohol swab. For whole blood test, new disposable lancet. New disposable gloves. Buffer. Timer. Lancing device. And for serum or plasma test, micropipette and yellow tip would be prepared. Now remember, all test materials must be used immediately once opened. When using sample or serum or plasma, let's begin the test. Check the expiry date on the back side of the test pouch. If expiry date has passed, use another kit. Put on the gloves. Remember, use new gloves for each patient. Open the test pouch and set the test device. Write the patient's name on the test. Using a micropipette, take 10 microliters of serum or plasma and put it into the round sample well. Discard the used yellow tip immediately in the sharps box. Add 4 drops of buffer into the same round well. 1, 2, 3, 4. Wait 20 minutes. Remember, do not read the test results after 20 minutes. Reading too late can give false results. When using whole blood as a specimen, check the expiry date on the back side of the test pouch. If expiry date has passed, use another kit. Put on the gloves. Remember, use new gloves for each patient. Open the test pouch and set the test device. Write the patient's name on the test. If you have a lancing device, assemble the lancet with lancing device. Unscrew the cap from the lancing device body. Insert the lancet into the lancing device holder and push down firmly until it is fully seated. Twist the lancet protective disc until it separates from the lancet. Screw the cap from the lancing device body. Open the alcohol swab. Grasp the 4th finger of the test patient's hand. Clean the patient's finger with alcohol swab thoroughly. After cleaning the finger, it must be allowed to air dry. Remember, the alcohol must be dried before pricking, or test may not work. Do not blow or wipe the finger when you dry. Pull out the lancing device body as far as it will go and then release it. It makes lancet ready to prick. Push the blue button on the lancet device. Inside lancet will prick the patient's finger. Discard the lancet immediately after pricking the finger. As the blood bubbles up, take a disposable capillary pipette and draw the blood into the capillary pipette to black line. The amount of blood collection is critical. This is the correct amount of blood. It is too little. It is too much. Add 20 microliters of drawn blood into the round sample well. Discard the capillary pipette immediately in the sharps box. Add 4 drops of buffer into the same round well. One, 2, 3, 4. Wait 20 minutes. Remember, do not read the test results after 20 minutes. Reading too late can give false results. Only one line C on result window means negative. 2 Two color bands on T and C line mean a positive result for Treponema pallidum antibodies. If no line appears near the letter C, conduct test again with a new test device and new disposable capillary pipette. Dispose of test materials such as test device, gloves, alcohol swab, desiccant, and packaging in a non-sharps waste container. Record the test results. Now, remember, each test can be used once. Do not try to use the test more than once. When you have a problem with your test, it could be solved by the following. Check specimen integrity for evidence of bacteria contamination, hemolysis, and lipidic substances. Verify labeling, paperwork, and procedures. Have the same technologist retest the specimen. Repeat testing blindly by another technologist. Repeat on reference test blindly. Repeat at different laboratory or reference laboratory. Determine true status by other assays. Recheck equipment and reagents.